Should you shave your V before you give birth to your baby, and how on earth do you navigate that baby bump? So just to start this video off, midwives don't give two hoots how you look down there. Full bush, half bush, semi-bush, slightly trimmed, not trimmed, whatever it is that is going on down there, we don't care what it looks like. But as always, it's about your choice and what you're going to personally feel comfortable with. And there are risks and benefits to shaving your hair before you give birth. We know that there are a lot more women who are shaving because of the increasing demand of certain videos that our society as a whole watches. A lot of recent studies have shown around 80% of women will shave their hair at some point, which has increased over the generations. And the same with men as well. Now, routine shaving actually came in around about the 1970s, where the medicalisation of birth happened. Lots more women were going into hospitals, so they were having routine enemas, routine shaving and routine episiotomies as that medicalisation of birth, particularly with obstetric doctors, increased. The doctors who were seeing them in hospitals thought that birth was very unclean, and so thought that by shaving women it would reduce the chance of infection postpartum. Like so many things that have happened over the last 30 or 40 years in terms of birthing babies, there was zero evidence for that. And all the research shows that there is no difference in infections whether you do or don't shave. So routine shaving was chucked out of the window, thankfully. Particularly as most of that shaving happened by midwives, by doctors to women when they entered a unit. And it's another really invasive thing that can happen during labour and birth by someone you don't know. It's not very comfortable, it's not very dignified. So I'm really grateful that routine shaving is long gone here in the UK. If you are thinking about removing hair, trimming is the safest way to prevent ingrown hairs. It's also the safest way to reduce the chance of bacteria and infection. And again, trimming can happen by a partner, for example. Getting around your bump, whether you're trimming or shaving, is an incredibly difficult task when you have got a large bump in front of you. And if you want to shave or trim, this is where asking your partner to do the task for you can really help. The least they can do during your pregnancy is help you out if hair maintenance is something that is important to you. Like I've said before, midwives don't give two hoots about what you look like down there. Waxing is another alternative option, but it can increase the chance of ingrown hairs, which is something you really don't want to factor in the postnatal period. The other thing is the pain and discomfort that comes with waxing. If you do choose the waxing route, find someone who's reputable and trained in waxing in that area. The other option for hair removal is hair removal cream at the top of the pubic bone for women who are choosing to have a caesarean birth. This has been shown to have a lower chance of bacteria, which can potentially lower the chance of infection postnatally. Hair removal creams are not recommended around your vulval area though, because of the way that it can irritate and burn and potentially cause problems in that area. I also want to add that removing hair in general and not having a bush can actually reduce the pH of that area and increase the chance of itching and also irritation in that area. All things you might not want in that postnatal period to have to tackle as well. And finally, as for shaving prior to a caesarean birth, it is now recommended to only shave on the day of the caesarean birth, or alternatively a week before. And the reason being, there has been an increase of bacteria found if women have shaved the day or two before the caesarean birth. So it's normally recommended either not to do it at all, to consider the hair removal creams instead, to do it a week before, or alternatively on the day of the caesarean birth, literally just before you're about to have your caesarean and have all the scrub and the cleaning. Guidelines do vary, however, but there is the Cochrane research trial that you can have a read of if you want to know more. And for more pregnancy, birth and parenting information, hit the follow button for more.